Make yourselves comfortable, I guess, in your homes. It is a wild new world that we're living in with these Zoom panels. I'm going to give everyone a chance to sign in here. Just as a reminder for this conversation, if you are on Twitter, you can tweet using the hashtag #SustoXCSPI. Folks are still tuning in. I'm going to give it one more minute. Hopefully none of the creatures in my house jump in here. So, okay, so for those of you just joining us, my name is Helena Bottomiller-Evich. I'm the Senior Food and Agriculture Reporter at Politico. I am going to be moderating the conversation tonight with a great panel hosted by the Center for Science in the Public Interest. I'm going to go ahead and introduce the panelists, and then we are going to kick off a bit of a conversation about the film El Susto. And we are then going to take a lot of questions from the audience. So feel free to use the Q&A function at the bottom of your screen. You can ask questions directly. You can go ahead and submit as many as you want throughout the conversation. And then about halfway through, I'm going to start taking questions from the audience. So we really want this to be interactive. We encourage you to jump in. We really have an excellent panel. Of course, we have the actual director and producer of El Susto, Karen Akins, which is great. Really an interesting film. I'm sure many, if not all of you, have already watched it. Karen is an emerging documentary filmmaker who was originally trained as an urban designer that specializes in creating environments to encourage physical activity and community interaction. And really, I think she has a long and interesting career path that sounds like it winds through many different industries and fields. So I think she has a very unique perspective in creating this film. We also have Alejandro Cavillo Una, the executive director of El Poder del Consumidor, a Mexican consumer rights group that he founded in 2006. Alejandro's work has focused on raising awareness of the devastating obesity and diabetes epidemics in Mexico, and he's really led the way for pressing major policy changes, including the country soda tax. And he is, of course, featured in the film. We also have Laura McCleary, the policy director of the Center for Science in the Public Interest. Before CSPI, Laura spent 9 years at Public Citizen, including serving as director of Congress Watch. And after that, she served in several leadership roles in different consumer and reproductive rights advocacy groups here in Washington. I should mention I'm also here in Washington. So just as a reminder, if you're on Twitter and you want to follow the conversation there and weigh in, the hashtag is #LSustoXCSPI. So to kick things off, we're actually going to go straight to Karen and talk a little bit about how this film was even made. You know, what was the genesis for the film? How did you come at this idea, and why did you decide to make a film about it?
Thanks for having me, and thanks to all my fellow panelists for being here. So let me tell you a little bit about how the film came about. There was a nurse in Vermont, a diabetes educator, who had been traveling down to the Yucatan, putting together volunteer medical missions for 10 or 15 years. And I just happened to answer an ad that she had in a local newspaper looking for volunteers to help with the mission. And I said, what would I do? And I said, they said, I don't know, move tables, carry supplies, you know, an untrained volunteer. But it was really good timing for me. I just finished raising 2 teenage boys, and I kind of needed to clear my head. So I went on this volunteer mission to Mexico for a month, and I had diabetes, nothing, no medical background, but I sort of saw firsthand what was happening there with very high rates of diabetes. And, you know, it was really distressing to see that. have to tell somebody in my horrible Spanish that they had high blood sugar and to refer them to one of our diabetes educators. So that's sort of how I got involved in it on a very, personal level with the people that we were testing. And, at the same time, I was seeing just these massive amounts of Coca-Cola being drunk everywhere and signage everywhere. And I knew that that wasn't normal. I had lived in Mexico back in the 70s, and I hadn't seen any of that. So for me, it was sort of a new development, and I just was curious as to how it all came about. So it was a combination of seeing firsthand what was happening to people, and then also seeing how much the food environment had changed since the last time I had spent any time there. So that's really how it came about. And the more I got interested in the subject and the story, the bigger gap there was between like what people knew about it and what they needed to know about it. And it seemed like a documentary would be a really good way to tell people the story and to educate everybody about this preventable disease.
So how long was the process start to finish? I mean, from that point to where we are today?
Well, some of the footage in the film I actually took back in 2008. I'm not saying all of it, but that I was sort of going to make us like a silly little YouTube video. But then the importance of the whole subject hit me, and then also certain things that happened to the food activists also made me want to bring it up to a higher level and do a really good job so that more people would be able to or would want to watch it. I didn't want to do something crummy where wouldn't have an audience. So I had to raise the standard of what I was trying to do, just so that more people would watch it and have a wider audience.
Okay, and just one quick follow-up. Was it difficult to get some of the footage, or did you find that mostly like participants were very willing to talk about these issues? Because some of them are pretty sensitive and controversial.
Right. Well, I mean, documentary filmmaking is very much a trust exercise between you and the people that you're filming, and you have to know how much you can push somebody, and you have to develop a relationship with them. So, I mean, it's a real process. When we were interviewing people, we almost always had a local volunteer or a connection that, I've been going down to some of these small towns in the Yucatan, since 2008. So we had established relationships. But for example, when we went to Michoacan and we interviewed people in the graveyard during Day of the Dead, we didn't know those people. And it was more of a ambush type of thing rather than a trusted relationship. And we did get a lot of people that didn't want to talk about it, but people do like to talk about themselves. And so we would always, though, have a diabetes educator with us to, even while we were interviewing them and after we interviewed them, that would give them information and do blood sugar testing there on the spot, because we didn't want to just come in and interview them and then just leave. We wanted to leave them with some information and blood testing strips and glucose meters that they could actually use to help themselves after we left.
Interesting. Okay, Alejandro, I want to turn to you. You are featured in the film for those of you who watched it. I'm sure most everyone has. And Alejandro, you're muted, just so you know. I'm curious if you could talk a little bit about the moment that we're in now with COVID, and how much just discussion there is around diet-related diseases and how that puts people more at risk for serious complications related to COVID. It sort of feels like nutrition is being interwoven into that topic as we're discussing it internationally. Has it changed the debate in Mexico at all as you're looking at, continuing to raise awareness around this? Oh, you're going to have to unmute yourself, or the host will unmute you. There we go. Okay.
Yes, we have a very strong discussion. We have a new government, and this new government not have these strong links with the big food and the big soda industry that the past administrations had. No, this new government in this area, also in the Ministry of Economy, also breeze like the Food and Drug Administration. All the people that front of the relation with industry and industry thrive this relation. They say we don't want to invest in that reports that the health each day, at night, is given about the situation of the COVID-19 in Mexico. Many times it shows the diabetes, the hypertension, the obesity, factor that increase the vulnerability of mortality of men in relation with COVID-19. And many times the Undersecretary of Health, that is the person that is giving this report daily, and also the President, talk about the health impact of the soda consumption, high level of soda consumption in Mexico, and also the high level of ultra-processed consumption in Mexico, because in the reports from the Pan American Health Organization, Mexico has the highest level of ultra-processed food consumption in all the Latin American countries. And at this moment, we have, when Karen came to Mexico in this process, we have this battle to promote the soda tax. And we have now a very strong battle to promote a front of pack warning level, that was approved.
Can you explain that just quickly for those who might not be familiar with what's going on in Mexico? We don't have front of pack warnings even on the table in the United States. So.
Yeah, the first country, I think it's very important what is happening in this area in the Latin American countries, because the first country was Chile. Mm-hmm. And they have this octagon, the black octagon, that say high in sugar, high in fat, high in calories, high in salt or sodium. And this is excellent. It's one of the regulations that is proven a very good results. In the case of Chile, now they have a reduction of more than 24% of soda consumption, about 14% reduction in cereals with sugar. And we, in Mexico, we have a very similar front of pack labeling that needs to become in the products next October. But you can imagine all the battle from the big industry against it, and using all kinds of strategies against the introduction of this new front of pack labeling. And this is something that is happening at this moment in Mexico.
Now I'm muted. It's because my cat is literally running around, so I muted to save you all from that. But so my husband's laughing at me now. So I'm wondering, what do you think the likelihood is that the front of pack label warnings will make it? Like, is it up in the air right now? I know that there's a lot of fighting on that topic, but what do you think the likelihood is that they make it to the stores?
Yeah, we hope that in October we have this in all the products, because at the beginning they had the possibility to use stickers, to put the stickers. This happened in the past in Chile, but also a very similar front of pack warning level is now in Peru, and is to improve it in Uruguay also. That is the reason why. And something very important that happened in Chile and happened in Mexico is that a product that have one or more warning level, in the package could not have any character or any kind of design aimed to children. No, the characters of films, Tony the Tiger. No, this will happen in April of next year. In October, the products need to have these warning levels. In April of next year, they cannot use any character or promotion to kids in the product that have one or more warning levels. No? And it's something very important is that this kind of warning level was proved together with many different kinds of front of pack labelings. No? And this is the warning level is the kind of front of pack labeling that most people understand. Also, people with very low education, no, and rural communities.
On that point, like Mexico, it's our southern neighbor. It's in a totally different place in terms of having this conversation nationally, right? Your debate is very front and center. You have active policies, in the works that are either enacted or going to be enacted. Are you hearing from a lot of leaders in the US and elsewhere, whether it's locally or at the federal level, who want to learn how to do what you're doing? Are more people calling you now during the pandemic saying, okay, like we need to do something about our diet-related diseases? Have you seen any difference in the interest?
We have a lot of contacts, most with Latin American countries and colleagues in the Latin American countries. When the soda tax passed in Mexico, we have a lot of relations with many cities in the United States, and we have a very good relation with the Center for Science in the Public Interest that we learn a lot from you, no? But at this moment, we are changing information more about the strategics from the big food and big soda in relation with COVID, how they are using this pandemic, no, as an opportunity to develop more marketing or donation to give their products to poor people, and we are making the news about this situation.
So you mean like more private sector donations to sort of get PR during the crisis?
Yes, it's a lot. And I saw this kind of marketing in CNN and other TV channels, no, that came from the United States.
Yeah. Yeah, it's there are a lot of tactics, and this is something that the film goes into, just the amount of pushback and just the strength of the industry coming out against many of these different policies and pushing really hard. Could you talk a little bit about what has made a big difference in Mexico in terms of beating the industry, because it doesn't seem to be, guaranteed in a lot of places. There's a really, really strong pushback.
I think in the case of Mexico it's very important the role from the National Institute of Public Health, that is a governmental institution of research, that the mission of this institution is to give the government the science evidence to develop policies, no, for public health. And it's very independent. No? In the past administration, they received a very strong push to not make the public declarations. The Minister of Health give the order to the researchers that they cannot have any public opinion. But now they are playing a very important role. And the academy was very important, and also the role of the PAHO, the representatives of the Pan American Health Organization, and now also the position from UNICEF, from FAO, together with PAHO, promoting and supporting the front of pack labeling. And it's very important, the academic with the National Institute of Public Health, the United Nations agencies, the civil society, and a group of universities supporting, but we have also universities that receive money from the industry. But I think the role of the National Institute of Public Health and the agencies from the United Nations is very, very important in Mexico. And now the position from the health minister, also the economy ministry, is very, very important.
Yeah, I mean, it's interesting. I think it's difficult to, you know, parallel it to the situation in other countries, but yeah, I learned a lot. I think a lot of people did from watching the film. Laura, I want to turn to you just to talk a little bit more about the US and sort of why the experience in Mexico, or how the experience in Mexico is relevant to the United States, just in terms of not just soda taxes, but all the various policies that health advocates are always trying to push to reduce sugary drink consumption in the US.
Well, thanks so much, and I really appreciate the panel and the interest in this issue. I thought the film was so powerful. It makes sense what Karen said about how she related to it through the work, the volunteer work she did in the clinic, because it had such a compassionate eye towards the people that were in the film and what they were grappling with in terms of their health. But it also, I thought, put a really amazing context around it. You know, we talk about in our work how the food system is a built environment that's structured in a way to allow people to profit from a system that makes us all sick. And, you know, that's a little bit subtle sometimes for an American audience. I think the film makes it super clear how the industry can work to make soda everywhere, even in rural places. And, when, you know, I got a chill personally when they talked about privatizing the water supply so that people wouldn't, you know, would drink soda rather than having safe water to drink. We have obviously a public system of water utilities here in the US, but pretty much everything else in the film that portrayed the way the industry acted was deeply familiar to advocates, though it's not something that people are aware of and living in the way that the film had urgency. You know, the soda industry in the US, just like in Mexico, is in every place. You can't go into a town in the US and not find it in every gas station and restaurant and university or you know, public park. They pay the grocery stores to put soda 25 times around the store at the end of aisles and in the checkout and at eye level and in the deli counter to make sure that you really, really have to not want to buy it before you leave the store without it. They pay for targeted marketing of communities of color in particular and low-income communities, spending you know, billions of dollars on particular venues that cater to Latin American, Latinx audiences in the US and people of color more generally. They specifically target kids so that Black and Hispanic children see twice as many ads for sugary drinks as their peers who are white. And, you know, so it's the same playbook. They try to influence politicians, they manipulate the science. It's all very familiar. And yet the advocates in Mexico have been so successful at putting this issue at the heart of national policy. And I would like to see the same urgency in the US. Although our rates of diabetes per capita aren't as high as Mexico, our number, the absolute number of people who suffer from diabetes in the US is twice as much or more. And the absolute number is what should matter. That's the number of human beings that are suffering from a disease condition. And as Alejandro said, you know, what we see is that we're only as strong as the most vulnerable people among us when something like a disease comes through. So we have this global pandemic, and the people being hit hardest by the pandemic are the same people who are dealing with occupational exposures, structural racism, discrimination in healthcare, and disproportionate targeting by industries that seek to profit from making them sick from the food that they eat. Those are the kinds of things that we take from the film, and we're really energized and inspired by the work that they've done in Mexico. You know, we have an ambitious agenda for our work at CSPI in terms of reducing sugary sweetened beverages or sugary drinks among Americans, and we're taking our playbook from them.
At one point in the film, former executive director Mike Jacobson, although I don't know, it's weird to call him former. He still feels involved and ever present, but
I always love Mike.
yeah. So at one point in the film, he has this line where he says, you know, he basically praises Mexico and says, quote, "Most countries are not doing anything." And I don't know why that kind of stuck out to me. It certainly feels true in the United States in terms of there isn't some big national policy push to reduce sugary drink consumption. I mean, that's just not something we're debating. And I'm curious, Laura, what you see, like if the political landscape changes at all in Washington, if there are openings going forward, whether it's the Senate or the White House, or whether or not you just feel that, you know, continuing to march forward in these states and cities is sort of the way forward, or like what do you think's next on that front?
Well, I think we made some progress under the Obama administration because they really put food policy first, but not as much progress as we should have made, and not as targeted around sugary drink consumption as it should have been. I think we have a real opportunity. We, you know, our science advice on diet is set by the dietary guidelines. And last week, the key committee made a recommendation that we should reduce added sugars in the diet to 6% rather than 10%. That means that we're pushing in the right direction with the current changes to the food label that we have, but we have a lot more work to do to get anyone's diet to reflect such a low number of added sugars. And we would mostly get there by reducing sugary drinks. So we have ambitious plans. If there is a political window of opportunity, we want to push forward on a national soda tax called the SWEET Act that's been introduced in several Congresses. We want to think about restaurant icons that are warning labels similar to the ones that Alejandro mentioned. That would be, New York City has them for sodium. There's like a little salt shaker and then a disclaimer at the bottom. We want those for sugar. We want to support San Francisco and other jurisdictions if they want to put warning labels on soda advertising. And we're working to reduce the amount of sugars in schools, on kids' menus, at restaurants, in public places, and you know, all sorts of like parks and recreational centers, those kinds of settings, correctional facilities. So we have a big agenda to reduce sugar consumption. Our vision is that we would like sugary drinks to be once a week or twice a week for most adults, and to not be consumed at all by kids. And, you know, you have to think about sort of all the different policies that you could bring to bear on that question. And that's really our agenda.
Yeah, it'll be interesting to see if there, you know, the other thing that sticks out about the Mexico example is how crucial it was that it raised a lot of money. Looking at it from a you know, any kind of tax, as soon as you identify it as a way to raise money for politicians who need money, then it becomes a different dynamic. And we are certainly definitely in the phase of just spending a lot of money in Washington right now, trillions and trillions of dollars on the, you know, different aid packages for the responding to the pandemic. We're getting a lot of questions already, so I'm going to go ahead and bring some of these in. Just as a reminder, you can use the Q&A function at the bottom of the Zoom screen to ask questions. And if you're tweeting, continue to use its hashtag #Susto X CSPI. And I will also check Twitter if you want to ask a question that way. So the first question we have here is from Robin Limagos. I'm gonna butcher your name, I'm sorry. The question is the World Health Organization supporting and publicizing what Chile, Peru, and hopefully Mexico is doing? I don't know if Alejandro, you're in a good position to answer that. Like, is there support either explicitly or implicitly for the work that's being done? And you are muted, so unmute yourself.
As you know, the representation of the World Health Organization in the region is a Pan-American health organization. And also the World Health Organization have similar offices, regional offices. And these offices have, some of these offices have some positions that I think are in the front. And in the case of the Pan American Health Organization, they support the soda tax directly. The representative at this moment from Bajo in Mexico was in public conference, press conference, supporting the soda tax. In this case of the front of pack warning level, no, had the support from the Pan American Health Organization in Mexico, no, and support what's happening in Chile, in Peru, and in Uruguay. No, it's very important the people that are in front of this, and also, no, the representation in Geneva, no, support this, not as a global proposal, but as a regional proposal that could be an example for other countries.
Interesting, thank you. Okay, we also have a question from Robert Lustig. This is also for you, Alejandro. He says, during the pandemic, processed food companies are actually doing better in the United States. Kraft can't even keep up with the demand for macaroni and cheese, or mac and cheese. Did the understanding by the populace of the relation between sugar and diabetes in Mexico have any effect on processed food consumption in Mexico during the pandemic? Really interesting question. I would not have thought of that. And you are muted, so unmute yourself. There you go.
Yeah, nice to say hello to Robert. No? Yeah, the problem is that we are looking at the consumption of ultra-processed food is increasing because the people not have easy access to fresh vegetables and fruits, no? And the industry is delivering, no, junk food directly to houses, no? And in the case of Mexico, we have more than 1.5 million little stores, no, in all the country, no? In most of these little stores are inside very poor areas, no? Is very poor families that have a room that is in front of the street. They open a window, open a door, they have a room with junk food that came from Coke, PepsiCo, Bimbo, no? All these trucks are, no, going to all the country given this food. But something interesting is that this government have the interest and is doing a lot of declarations about we need to recover our food, healthy food, no, that we have in the past. No, they have a very strong declarations against soda, no, and against junk food. No, the president and also the undersecretary of health and other members of the government.
But do you know, are you measuring the actual consumption in real time? Like, obviously it's prevalent, and imagining trucks driving down the street, that's certainly, you can imagine how easy it would be to get, you know, all those convenience foods.
Yeah, no, we don't have data, but something that we know from reports in many other countries is that it's increasing the sale of this ultra-processed food.
Yeah.
No? And it's very important. We did webinars and press conference denouncing this situation, talking that ultra-processed food are related with inflammation and affect the immune system, no? And that the fresh food, vegetables, fruit increase, no, and strengthen the immune system.
Yeah, it's kind of interesting. In the US, one of the foods that is consumption's way up on is orange juice for that reason. I think a lot of American consumers were like, well, I'm going to eat my mac and cheese, but also I recognize I need more vitamin C for my immune system. So there's been sort of some interesting foods demand spikes here. We have another question here from Vidya Sivan. this person writes, I really want to fight against these companies in the US, but then they will continue to focus on developing markets in Latin America and Asia. What is our responsibility as Americans to prevent these American companies from engaging in this predatory behavior globally? That's an interesting question. I don't know if Laura or Karen, you want to weigh in, just that idea of, you know, if you fight them here, they'll expand. I mean, I guess the premise that question a little bit insinuates that they're not already pressing in every market, which I think they are, but I don't know if you want to comment on that, Laura.
Mike Jacobson wrote a great report, Carbonating the World, about the predatory behavior that has occurred from US-based soda industry interests as they've moved out to colonize global markets. And it is a real problem. I think there could be a more robust strategy where we hold companies accountable through shareholder actions or other kinds of things at home for their global responsibility for public health. We also work at an international body called Codex Alimentarius to try to protect the rights of countries to do the kinds of labeling that Alejandra was describing, where it is under attack from organized opposition by the soda industry that is seeking to use international trade norms to rein in sovereign nations and their ability to protect their citizens' health. But there's lots more that we could do. This kind of event is a great example of how we're trying to understand the activism across borders and think of ourselves as one effort, because really the problems don't know any boundaries, and there is enormous predation by the companies as they move out to find new markets.
This next question is probably for you, Karen. Someone is asking whether or not there are any plans, or if you know of a documentary that's going to look at different soda taxes and other efforts around the world, and like the political journey it takes to, or has taken to get those types of policies in place. Like, I don't know if anyone's looked at the situation in Chile with their labeling and food marketing work. Do you know of anything like that, or do you want to do that next? You're signing more films?
Any plans in the works, but I do know that the Berkeley Soda Tax Group has put out some wonderful videos celebrating the anniversary of their soda tax, and it shows how their tax is being used in children's farming programs at school and community gardens, and those are really well done, and those are on the web right now. So celebrating the victory and showing how they use their funds to improve the health of their community.
Just looking through here. There's a question here from David Cleveland. He writes, in the US, most higher ed campuses have pouring rights contracts with soda companies. Public colleges and universities have become dependent on this income. Is this also happening in Mexico? If yes, what is happening in Mexico to eliminate these?
Yeah, the relation from the great corporations with politicians in Mexico in the past was very, very strong, and also now, with some political parties, this relation is strong. In the case of Mexico, the law not permit that the big corporations give money for the campaigns. And this is something that I know happen in United States that is terrible. That the elections in United States have this big problem of conflict of interest. If politicians, I receive money to do my campaign, I have something to give when I be inside the government to these corporations. And but we have Coke is very strong in Mexico. Mexicans are the highest we have the highest consumption of Coke products per person in the world, no? But it's not only Coke. We have a Mexican company that the name is FEMSA. FEMSA is the most important bottle company of Coke. It's from Mexico, but in around the world. FEMSA is in many, many different countries. And the power of FEMSA is very, very strong. The principal lobbyist, no, of FEMSA is people that have very strong, very important positions in the political arena in the past. And not is only FEMSA, it's also Bimbo. Bimbo is the biggest bread company in the world, that is a Mexican company that also have a very strong influence in the politicians and in all the big industry associations. No? This is it have some difference, but the same power that in another country. But at this moment, we don't know what will happen in the future. But this government that have only 18 months in the government, that have very strong problems now, no? This government don't have these links with these corporations. In fact, they have a very strong fight with these corporations.
You're on mute.
My cat has stopped running around, so I don't need to mute anymore. One of the points made in the film is that I guess it was Coca-Cola was, you know, just really spending a lot of money in like elementary schools and, you know, a lot of branding. And we've seen that in the US as well. Has that been reined back, just on that note of like pouring rights? It's sort of a related issue. Like, do the soda companies still send a lot of money or fund or support elementary schools, or have a lot of the policies taken care of that?
The situation with the schools is a very long history. Since 2010, we have a regulation of food and beverage high school, but it's not improved, no? And
enforced?
Yeah, it's not enforced. Okay. And the question is that this industry have their products inside the schools, no? And they have disagreements between the company and each school, and more in poor areas of Mexico, in rural areas. They give some tools for the school, no? In change to sell the product inside the schools, or to paint the wall of the schools, or the basketball, no? They are inside the schools now, but we have a very strong critique about it, and we hope that this government change this situation.
Interesting. Okay, I think that gets to the question that David asked. We have another question from Juana Lee. She says, El Susto highlighted one of Big Soda's major tactics, attacking science, including funding junk science that skews research associated with sugar-sweetened beverage consumption. Are industry front groups, including ILSI, big players in promoting science in Mexico? Were any industry groups present during Mexico's sugar-sweetened beverage tax deliberations?
The association of the beverage industry, after the tax passed, 1 year after, they paid 3 different research that were not published in any science magazine, no? Only paid the research, and this research they use around the world to say that the tax was not working. To very important institutions, no? El Colegio de México, that is the Colleges of Mexico, no? That is one of the most important. No? They pay to some researchers from the El Colegio de México to say that the tax, so that was not working. To the University of Nuevo León, the north of Mexico, they pay another research that say the same. They do research, but never this research was published, no, in a science magazine. Never have a review per peers, no? And they have not only the ILSI, no, Institute, the Life Science Institute in Mexico, that they closed for some months the ILSI because we exposed how ILSI was trying to stop the soda tax, no? But the Aspen Institute also play a very important role supporting the industry and other institutions that receive money from the big corporations.
We have another question from Robin. The question is, why can't there be financial incentives for people who are resisting the pressure of selling sugary products or who are successful in curing themselves of type 2 diabetes? So that's an interesting policy question. Is that being debated, or do any of you have thoughts on whether or not you could offer financial incentives for people, like for individuals, to combat their own type 2 diabetes?
I think we do have a food environment that makes it very hard for people to make healthy choices. The temptations are everywhere, and it's not impossible to eat well, but you have to resist all of the temptations that are structured into the environment in order to see your way through to doing it. And you have to work harder. Often you have to prepare your own meals, at which people do face barriers to with all the work that they have to do and other obligations like childcare. I think we can do more to improve the price differential between processed food and fresh fruits and vegetables. I think we can support low-income families better in terms of making healthier choices. I think there's a lot of role that health insurers could potentially play in supporting healthy choices. I wouldn't want to tie the cost of health insurance access to anything related to diet for privacy and agency reasons, but it is more expensive to eat healthy, and we should do more to equalize those factors for individuals.
Okay, we have a follow-up on the ILSI question. Juana's asking, you mentioned, Alejandro, that ILSI Mexico dissolved into ILSI Mesoamerica. I think I have that right. But since that group focuses on several different countries and territories in Central America and the Caribbean, what is the presence like now in Mexico for ILSI? Or how has ILSI's presence shifted in Mexico?
I think that they are not playing an important role like in the past. I think the reputation of ILSI, I think 10 years ago or 15 years ago, was a good reputation, and now it's a very bad reputation because we can show how ILSI was like a tool of Coca-Cola, no? Also, the director of ILSI at the time that ILSI in Mexico was closed was a director of Coke, no? We can show a very clear relation. Also, they organize a forum in Mexico to talk about beverage, and they invite James Rippey, no? That I don't know if you know James Rippey from the Rippey Institute, that is a terrible group of scientists paid by Coke, by PepsiCo. They work for all the junk food industry, and they receive millions of dollars. And we expose all information how they receive $10 million, no, from the Corns Refinery Association, no, to say that the sugar that came from corn, no, not have a cardiovascular impacts, no? And this was a response from this industry against a report made by researchers in California that show a very clear relation, no, with this sugar that came from the corn with cardiovascular diseases. No? And we exposed all of this, and ILSI, the reputation of ILSI went down. No? And they don't have an important role. I don't know if behind doors they are trying to do something.
Interesting. Okay, I think we've answered that question. Karen, I want to flip it to you to talk just a little bit about whether or not there was anything in the film or anything that didn't make the film that you found really interesting, or if you could talk a little bit about if you've gotten any reaction to any of the from any of the players that you featured, whether or not it was an individual or the shaman or an advocacy group. Like, what has the reaction been to the film, just from those who have seen it?
Well, the first time anybody saw the film was about a year ago. I took it to a group of Mexican academics who were having a symposium in Cambridge last year. So they were all Mexican nationals, and I screened the film for them, and I had no idea what their reaction was going to be, but they really loved it, and I don't really still to this day know exactly why it resonated with them so much. I thought I was making a film for Americans to learn about what has happened in Mexico, but I think the Mexican nationals appreciated the fact that we were talking about this issue and talking about the success of the activists and sort of rewriting the narrative about the way things are in Mexico so that everybody can see the positive things that can happen there when so much of what we're seeing in the media is all about drug cartels and murder. So I think like for that was the strongest reaction that I got, is the warmth of seeing the film from Mexican nationals. And then, every time I show it to anybody, I always worried about what they were going to think if I butchered their life's work or whatever. But we've had really positive feedback from everybody from CSPI to Mark Pendergrast, who is a Coca-Cola unofficial historian, and he loved it. But each of these people that you spend time trying to summarize their work and present it, people have been very positive about it.
Yeah, I can kind of sympathize on that. When people spend hours with you and then you have to distill down their thoughts into very small, sections of your story. Similar.
I want to say something.
Yeah.
No, because I want to have the opportunity to say congratulations for this work, to Karen. It's an excellent work, and it's very important to show this work in Mexico at this moment. It's very, very important. We saw many documentaries about this situation, more in Chiapas, that is very famous. James Oliver, this chef from United Kingdom, came to make a documentary to promote the soda tax that they obtained in the United Kingdom. The TV from France, the TV from Germany came, and I think this work from Karen is one of the best about this situation, and it's very important to not only for the people in the United States, but for Mexico and from all the countries, because we have the same problem, different ways in all the world. In Nepal also.
That's right.
Are you going to show it in Mexico? Are there going to be showings or?
We have been working very hard on a Spanish version of the film, so that we weren't just subtitling our English version, but we actually have done a Spanish version of the film, and we will release online the Spanish and the English versions at the same time in the fall. So it will be widely available in a few months, and we're talking about the timing of it with Alejandro and his group. But because of their reaction to it, we didn't want to have the Spanish version be an afterthought. We wanted that to be as important, and it may be more important than the English version. I don't know, but that's the plan.
Interesting. Okay, we have a question about Oh, the farm bill. I don't know if we can go into that. We only have 4 minutes left, but I'll think about it.
To key off that last conversation though, and I'd say, like, I don't think, we'd like to also help get it more wider in circulation in the US as well. I mean, I think there's tremendous opportunity for audiences to really identify with the people in the film and with the struggle of the advocates and with their success. There is, as you noted earlier, the need for a lot of backfilling of municipal and state budgets. We've seen Seattle and San Francisco use the money from their soda tax to address nutrition adequacy and food needs that people have for the coronavirus. We think that a sugary drink tax could be a win for communities that helps fill coming budget deficits that are looming in so many places and will continue to be a problem. So, this is our initial effort, but we want to do more to get it in front of US audiences as well.
Mm. And I mean, it's my fondest wish that this film can be used for all of the people that are out there in every country working on these issues to kind of raise the level of awareness so that they're not just fighting little political battles, but everybody in their community or their state or their country can understand the rationale behind the tax and open their minds a bit. When we were in Amsterdam, we did a raise of hands of the audience who opposed the sugar tax. We did it before the movie and then we did it after, and it really softened the opposition. I think we had one guy still with his hand up after watching the movie. So I hope that you guys can all use it in your advocacy work.
We have a question here from Allison about whether or not the soda tax has reduced sales and consumption. Whether or not there's been changes in the sales or consumption of diet beverages in Mexico as a result of the soda tax. Have those increased or changed as a result? Like, are people substituting with them?
We have in Mexico 2 independent research that did this evaluation about the consumption and sales 1 year and 2 years after the soda tax passed. And in average was a reduction of 8%. And recently was published in a research in health workers after 3 years, and they found similar reductions and more in people that drink a lot of soda in the past. They have a bigger reduction in soda consumption. But something very important to share is that our proposal for the soda tax in Mexico was at least 20%. No? That was the recommendation from the World Health Organization at one moment. But we obtained only 10%. That is half of the proposal. But in places like Philadelphia, no, UK, no, Seattle, and other places that establish a 20% or more tax for the soda, the reduction is bigger, no, than in Mexico. This is very important, and we are fighting to increase, no, the soda tax in Mexico. And also we are fighting, no, to have these resources, no, to go directly to health policies, because they are not going directly, they are going anywhere.
Interesting. Okay, we have another question just on whether or not everyone who's watching the webinar and who's signed up, whether or not they're going to be notified when the film comes out, or when the English and Spanish versions come out online. So
we can make sure that they are, for sure.
Okay, because I thought that was, yeah. I'm going to go ahead and squeeze in one more question, and I'm sorry to the person who asked about the farm bill, because we could do an hour on that. Let's see, we have one from an anonymous person who went back to the dietary guidelines and how those recommended a reduction in sugars consumption, which I think is notable because when that recommendation came out during the Obama administration or the Obama era, that was considered kind of controversial, and there was a little bit of heartburn about that. And now, we have another committee basically saying it should be stricter. But this questioner notes that, many of the committee members have ties to the industry, and they want to know specifically whether or not that committee is credible, and how can civil society ensure our future federal nutrition guidelines are impartial rather than being co-opted by the industry.
Well, we're as concerned about conflicts of interest with the dietary guidelines as any other group, and there have been some reports by our colleague organizations about ties that some of the members have to industry. But the durability of the recommendations is really remarkable anyway. The dietary advice that came out of this recent round of the Dietary Guidelines Committee is largely consistent with prior rounds of the dietary guidelines. And the truth is that nutrition science is in pretty solid footing, and it doesn't change that much. We fight to make sure, along with our partners, that the scientific evidence is fairly presented to the committee, and we were relieved to see that they were following the evidence in this round as they have in prior rounds. There are always scientists with industry ties on the Dietary Guidelines Committee. We closely monitor the situation. I don't want to downplay the issue of conflicts of interest on the one hand. On the other hand, the science for many of these recommendations is so robust that the recommendations do stay fairly stable over time. And we were grateful that the committee took a hard look at added sugars in the last round and reaffirmed the earlier position that it should be limited.
Yeah, not only that, but also it looks like they're likely to recommend that men should consume less alcohol, that the alcohol recommendation might come down, or the definition of moderate drinking would go down from 2 to 1, which I think surprised some people as well.
Yeah, I think, there was a big fight over alcohol in the last round, and it was a sort of sleeper issue for this one, and it was a good recommendation. We've been working for decades to try to get the federal government to put calorie and ingredient labeling on alcohol, which is just a no-brainer. Of course, consumers should know how much of their calorie budget in a day is taken up by the beer that they're having with dinner, or the several beers that they're having with dinner. And it might be a win-win for health, because they would be thinking about their waistlines and also saving themselves from other harms from alcohol abuse. So, we'd love more attention on that issue. We were strategizing today about it, but those are good recommendations. And, we think the committee made some very strong science-based and evidence-based recommendations across the board, including on added sugars and alcohol.
Great. Well, on that note, I know we're a few minutes over here. I also just there's a lot of people saying thank you, and there's a lot of other questions we didn't get to. So hopefully participants can figure out ways to reach out, or maybe they can take the conversation on Twitter. And again, the hashtag is #SustoXCSPI. So I will have to jump on Twitter and see what you all have been saying. I want to thank everyone for joining this evening. Thank you to the panelists and to CSPI for organizing. Really interesting conversation. It's a super fascinating film, and I think a lot of people are going to learn from it. And I hope anyone who watched who hasn't had a chance to see the film yet can go check it out. I believe everyone was given a password and a link to watch that, and it sounds like it will be coming out more widely in the fall. So thank you to everyone for joining. I hope you enjoy the rest of your nights in your homes across the globe, wherever you may be joining from. And thanks so much.
Thank you.
Bye. Thank you.
Thank you.
Thanks.